I've been estimating each year correctly for the last 20 years increases in First Nation suicides across the country and in most jurisdictions. And we've gone from 100 suicides per year at the turn of the century nationally to 200 plus suicides. So we've doubled in this last 20 years, 2 decades. In the last several years alone, we've gone from effectively 160 suicides to 196 suicides in 2019 and 223 suicides in 2020. What we haven't abated, that's remained unabated, not just over the last quarter of a century, but over the last 40 years, is a crisis uninterrupted where we haven't actually brought suicide prevention in sync with suicide awareness. And First Nations people are suffering under a whelm of socioeconomic stresses because the majority of suicides, the near all of suicides of First Nations people are below the poverty line. Nearly 100% of the suicides are below the poverty line. It is negligible, the suicides of First Nations people in terms of rate above the poverty line to their non-Indigenous brothers and sisters. It's the socioeconomic stresses that we need to alleviate and the pronounced negative behaviours born within those socioeconomic stresses. The lowest quintile of income base is the highest proportion of suicidality and suicides for First Nations people. I have worked with 500 families in the last 7 years, First Nations families who are suicide affected. And that is a cohort which is the majority of loss and grief to suicide in the last 7 years. That doesn't come from just some cluster or translation from a cohort or some exponentialism. It's an interface at the coalface with the majority of suicide-affected families across the country. So the data is as robust as it gets. The translation is indisputable in terms of suicides of First Nations people are predominantly below the poverty line. The majority live in social housing, and that's our poorest Australians after our homeless. And then there's a high number who are transient and in housing insecurity who are homeless. So it is socioeconomic stresses of the most crushing form. It is a crushing form of poverty that's fundamental to First Nations people, not fundamental to non-Indigenous people. In terms of Victoria, it is a similar story to the national story for First Nations people. They are predominantly people living below the poverty line, in the lowest income base, facing crushing forms of poverty. And during the COVID period over the last 2 years, where I actually estimated correctly there'd be a rise for First Nations and not necessarily a rise for non-Indigenous, because the fundamental factors of care systems do not prevail for First Nations people as they do for non-First Nations people. The near all are in social housing circumstance, and that's where our poorest Victorians live in the Victorian context. For Victorians in general, I estimated that the suicides of Victorians would remain stagnant, would remain high but stagnant, would not increase, as similarly so was the case for all Australia, for all Australians. Suicides did not dramatically increase, but they dramatically increased for First Nations people because they live a form of crushing poverty which makes supports inaccessible to them, and the pressures upon them are much more pronounced as they are isolated and have become isolated in the COVID experience. Suicide is not necessarily complex, it's multifactorial, it's layered. What takes your life above the poverty line is 30, 40 times more likely to take your life below the poverty line. The narratives and the triggers are 20, 30 and 40 times more likely to take your life below the poverty line than above the poverty line. And for First Nations people, even more so than non-First Nations people. We've also got to understand that poverty is relative and abject, and the construct of the abject touches First Nations people much more so than the relative poverty of non-First Nations people, of other Australians. Factors that lead to suicidality are much more pronounced the more crushing the poverty. And that includes low income base, which creates socioeconomic stresses, which pronounces negative aberrant behaviour that can, for instance, lead people to incarceration. And the rates of incarceration for First Nations people are horrific in this country. 1 in 6 First Nations people nationally living today have been to prison. That's an abomination, a hideous reprehension. 1 in 6. We have to think about that because the comparison is 1 in 50 Australians which is very high in itself too, which is 2% of the Australian population. 1 in 50 Australians have been to prison, but 1 in 6 First Nations people have been to prison. It's an indictment of our country. It's a similar scenario for Victorian First Nations people. It translates right across the country. In terms of suicides, to understand the enormity and the depth of the suicide crisis in this country, suicide is the leading cause of death for all Australians. 1 in 50 Australians, once again, will die by suicide. 1 in 50 deaths of Australians will be by suicide. 170,000 Australians each year will die. Of those 170,000 Australians, more than 3,000 are suicides. That's the leading cause of death. But for First Nations sisters and brothers, it's 1 in 17. 1 in 17 deaths of First Nations people, and a similar story in Victoria, are by suicide. It's a catastrophic, hideous reprehension, a humanitarian crisis. 1 in 17. It is a leading cause of death. 1 in 3 of deaths between 15 to 35 years of age for First Nations is by suicide, and it is the leading cause of death, suicide, of our First Nations children between 10 to 17 years of age. I've been working with Commonwealth and state and territory governments for a decade and a half. The problem has to be said. It is the lack of political will. It is also the lack of moral will within that political will to define what political agency should be had. We spend on research and consultations and trials. That's all well and good. It's got to be principles of proportionality. We've got to spend much more in terms of principles of proportionality on investments in suicide prevention on the ground, on community buy-ins for First Nations people, where there's a First Nations workforce and parity within that workforce of First Nations management of that workforce. We've got to do the buy-in into the outreach and the intense psychosocial supports. That's just not happening. It's endless research. It's disproportionate to the funding that hits the ground, and it's a tragedy that indicts our nation and indicts every, not just the Commonwealth, but every state and territory. Because even for Victoria, I was years ahead of my time in predicting that they were getting the numbers wrong, that they were in effect double the toll of suicide that was being reported. It was about the fact that they weren't identifying who was First Nations and who was not to the extent that it should be. And it was also the fact that our socioeconomic stresses, the accumulation of life stresses for First Nations people, and particularly during COVID, were on the increase, and even outside of COVID, before COVID, they were on the increase. But there's been a dramatic increase in the types of crushing socioeconomic stresses that have led more people to take their lives, and particularly our children with train-wrecked childhoods who are being left unsupported. Care systems and safety nets are not being put in and invested in to support families right across Victoria, regional and also in the metropolitan in Melbourne. For all Australians, what takes your life above the poverty line is 20, 30 and 40 times more likely to take your life below the poverty line. For First Nations people, it's even higher. It's even higher than what it is for non-Indigenous Australians, for non-First Nations Australians. Higher than 20 and 30 and 40 times. It could be 50 and 60 and 70 times as high, because the near all of all suicides of First Nations people are below the poverty line and are from the lowest income base, the lowest fifth, the lowest quintile of income base. That is the highest proportion of First Nation suicides, higher than non-First Nation suicides. So, for all Australians, what takes your life above the poverty line is many times more likely below the poverty line, but for First Nations people, it's even a higher rate than for non-First Nations. And above the poverty line, the narrative is this, the statistical narrative is this: the rate of suicide of First Nations people above the poverty line is actually less than non-First Nations. So the solution, the ways forward, are in the improving of life circumstances for First Nations people. In the end, poverty alleviation is the major driver and factor that will reduce suicides, and we can dramatically reduce them with significant poverty alleviation. But any type of support, psychosocial, and what you've just described as an intense psychosocial support, and the more funding, the more intense that psychosocial support, and the more assertive that outreach, and the greater the prevalence of that nurture, the greater the results would be. We need that community buy-in, but what we need is a mass investment in the improving of life circumstances and the retention of people through pathways to the improving of those life circumstances, whether it's through education, whether it's through employment, or whether it's just through supporting families to keep steadfast and stabilise their circumstance to improve the lot of the younger generation that's at risk. And they're at greater risk today, our younger generation, than that of past generations. The suicide rate for all Australians did not significantly drop as a result of New Start. That helped alleviate pressures and socioeconomic pressures. It also validated people that they're all in this same circumstance, similar circumstance, in a circumstance not of their making. But what actually occurred was there wasn't the spike that everybody presumed there would be, and I actually had argued that it wouldn't be the case, and I was actually fortunately correct. But for First Nations people, I had argued that the New Start increases would not be sufficient to offset the increased pressures that COVID would bring in the form particularly of isolation, and people actually taking into their households, into single-parent households, which are social housing households, public houses, where the poorest Australians live there after the homeless. A lot of their homeless brothers and sisters who had nowhere to go to. A lot of other family that was insecure in terms of housing and transient. And a lot of younger members of families that had brought on fatigue and exhaustion upon older carers who they weren't able to support and were looking for elsewhere. And a lot of households increased from 5 or 6 members in a family to 15. To 16 to 17. There are many households that I experienced, not just in Victoria, but right across the country, that had increased their household numbers. They were taking in other members of families, and they would be under enormous pressure that could not be offset by an increase in New Start alone. The pressures are psychosocial, and there's a lot of factors that are multi-layered that weren't being offset by the supports that weren't being put into place during that time. And one factor that actually was detrimental because of COVID was the lack of outreach. Whatever outreach did exist, the lack of outreach that was actually mitigated, reduced, because a majority of that was withdrawn because of COVID fears and lockdowns and the like, or whatever that required quarantining. The loss of outreach took away what little supports were in place, and the pressures just mounted. So there were an accumulation of harrowing and staggering life stressors and socioeconomic pressures that weren't known or were unknown to the families who were struggling on the very little income base that they had. I have very little faith in governments. We've had expectations betrayed, not just year in, year out, but decade after decade, and generation after generation. The betrayal of expectations leads to a sense of hopelessness and helplessness to the bleak, and to not being able to turn to anywhere. I'll believe it when I see it, when governments offer community-based resource. What we need is a lot of psychosocial facilities for people to turn to, for First Nations people in First Nations hands and management, and with a First Nations seasoned workforce and professionally developed. We need all of that, but we don't see the funding to actually supply the demand that is now being outstripped by increasing unmet needs. So the pressures on the existing community-based resources are mounting and toppling them. And that's not the situation we should be in a country of our affluence, and in a country that's the 12th biggest economy on the planet. And Victoria in itself is one of the richer and wealthier states with great asset wealth, and yet we betray the expectations and needs. We do not take a triage-based approach. So because I haven't seen it, and I've worked with governments for a decade and a half, and we've been betrayed decade after decade, and I also work at the coalface, I've seen the betrayal of these expectations mount, and I think I will continue to see much more of that. Things are getting worse, not better, and the unmet needs are increasing, and we have an effective tsunami of unmet needs. I estimated the doubling of the Victorian one for First Nations, and I was correct. And I'd really like to be wrong. I'd really like to be wrong, but it's sad. So I know I'm always a doomsdayer, but you know, to end that doomsday, all we need is governments to invest to the extent that they should, a substantive investment. It just doesn't happen. And I hope before my days are done on this earth that I see some of that happen, because child suicide rates, youth suicide rates are increasing. We've already got it as a leading cause of death for children, suicide. First Nations children, it's dramatic, it's catastrophic, and 80% of suicides 13 years and less are First Nations children. That should not be happening in this country. It's an abomination, and the fact that we do not invest in addressing this, and it's doable, it's not complex. There are specialist multi-layered needs. We've got to move from saying things are complex and that they're in the too hard basket to actually calling them out for what they are: specialist needs, unmet needs, and redress and address these needs. And we've got to go forward with the mass investments. We can afford these investments. When there's a crisis such as COVID, we find all sorts of funds to do all sorts of things, but we don't find it for the most pressing issue of our times: suicide and the loss of young children at 10, 11, 12 and 13 years of age. I've got no words. It should be unimaginable in our nation that we're in this predicament.